Hydathiform mole is also known as gestational tropoblastic disease. Gestational tropoblastic disease. It's a rare abnormality of pregnancy characterized by the growth of abnormal tropoblastic tissue, hydathiform mole. In hydathiform mole, there is blank fetus, amniotic sacs or blood vessels. Growth, no fetus. So there is no fetus, amniotic sac or blood vessels. The hallmark sign for hydathiform is the passage of clear, fluid-filled vesicles, grape-sized vesicles. No pregnancy within. So how do you manage hydathiform mole? To manage hydathiform mole, we must no pregnancy within 1 year to allow HG levels to decrease, the anki procedure, and methotrexate, an anti-neoplastic agent that kills rapidly dividing cells. No pregnancy within 1 year. Do not give methotrexate to a normal pregnancy because it may cause abortion. Recurrent hydathiform mole predisposes the patient to cancer, uterine cancer. The clinical presentation of hydathiform mole includes. What does that mean? The clinical presentation of hydathiform mole includes high levels of HCG. So, clinical presentation niya rapidly. So, the anki procedure, absent, no fetus, amniotic sac, absent fetal heart tone because there's no. So, the clinical presentation, so high levels of HCG, absent fetal heart tone, rapid increase in fundic height. Okay. So, high levels of HCG, sige suka sa muna yung makakos og suka, and rapid enlarging of the uterus, fundic height. So the hallmark sign of hydathiform mole is the passage of clear, grape-like vesicles. Rapid enlargement of the fundic height. Methotrexate, absent hydathiform mole, fetal heart tone. So high levels of HCG, no pregnancy within 1 year. Do not give to marry because it causes abortion. Procedure, DNC, recurrent hydathiform mole predisposes the patient to uterine cancer. So rapidly increase in fundic height. Congrats. Next is ectopic pregnancy. It's characterized by implantation outside the uterus while still having the placenta. Oh. The pathognomonic sign of ectopic pregnancy is severe, sharp, stabbing, knife-like abdominal pain. So makadungog kag knife-like abdominal pain, it's probably ectopic pregnancy. Another symptom of ectopic pregnancy is blank, refers to streaks of blood. It is important to report any blood in pregnancy to a physician. Hemorrhage, spotting. Cullen's sign is the discoloration of the periumbilical area, indicating a ruptured pregnancy, leading to bluish discoloration, shock. Cullen's sign is the discoloration of the preumbilical area, indicating the rupture of an ectopic pregnancy, which leads to shock. The pharmacological treatment for ectopic pregnancy, methotrexate, kills rapidly dividing cells, including the fetus that has miscarriages, therapeutic abortion. Kills rapidly dividing cells, methotrexate, blank position. Combating shock through proper positioning. So, if we have ectopic pregnancy, we are at risk for shock. One of his signs. So, we manage it by having modified Trendelenburg position because it lessens the pressure in the cervical area. The pathognomonic sign for ectopic pregnancy is severe, sharp, knife-like abdominal pain, stabbing, sharp stabbing. Management of ectopic pregnancy is elevate feet on bed. Trendelenburg precision, mild lang. Another symptom of ectopic pregnancy streaks is spotting. So, Cullen's sign, discoloration of the preumbilical area, indicating ruptured ectopic pregnancy, leading to shock. So, it's characterized by implantation outside the uterus while still having placenta. Characterized by implantation of outside the uterus while still having the placenta, ectopic pregnancy. So, pharmacological treatment for ectopic pregnancy, methotrexate, kills rapidly dividing cells, including abortion, miscarriages. The pathognomonic sign is severe, sharp stabbing, knife-like abdominal pain. Elevate. Okay. So next is incompetent cervix, characterized by painless cervical dilatation, while contractions usually before the 20th week of AOG. Painless cervical dilatation without contraction. Painless ang cervical dilatation niya without contraction, usually before 20th week, incompetent cervix. So, cervical cerclage techniques, Schrodkar, is birth niya is sa CS because this is a permanent na procedure. Cervical cerclage techniques is cesarean section kasa Schrodkar. And cervical cerclage techniques is sa vaginal birth, NSVD. So, technique is McDonald's. Management of incompetent cervix. We have cervical cerclage, vaginal rest, which means no sex orgasm. Management of ruptured membranes in incompetent cervix. Prepare for childbirth. Signs and symptoms of cervical dilation. Rupture of membranes, prolapse of membranes, induce absence of contraction. So, incompetence, cervix ka, absent imong contraction. Pero, nakay dilation. competent cervix. So management of ruptured membranes in incompetent cervix. So how do you manage ruptured membranes in incompetent cervix? Management of ruptured membranes in incompetent cervix, you prepare for childbirth. So incompetent cervix or ruptured childbirth, absence of contractions, prepare for childbirth, absence of contractions, prepare for childbirth. Painless cervical dilatation usually before 20 weeks. So wala pa jud via age of viability kay nag-dilate na ang mother before 20 weeks of age of gestation. So membranes of blank of membranes, what does that mean? Prolapse of membranes. So incompetent management of ruptured members, delivery, prepare for childbirth, and blank contractions, absence of contractions.
Have you seen?
So next, hyperemesis gravidarum. It's characterized by excessive vomiting due to increased hyperemesis gravidarum, increased HCG. Poses a risk of dehydration, electrolyte imbalance. So initial vomitus is late vomitus, presence of bile. Initial vomitus, undigested food. So sa kaninang ba is the product of liver. So compensatory tachycardia. So the body compensates by being tachycardic sa hyperemesis gravidarum. When there is no vomiting, SFF. What does that mean? When there's no vomiting, SFF. I don't understand that. Blank monitoring. Input and output monitoring. Choy, nagkuhanap lang suga, Choy. Sa kwarto. Poses a risk of electrolyte imbalance. Late vomitus, presence of bile. Initial vomitus is undigested food. Compensatory is tachycardia. When there is no vomiting, what is the management? Drinking water, SFF. Choy, sarad ipod ang kanya. Ang lamok niya. Please, brother. During acute vomiting, we must not have anything in the mouth. So use to decrease nausea and vomiting for hyperemesis gravidarum. However, more than 100 can cause defects in the fetus. Vitamin B6, pyridoxine. So less than 100 mg is used to decrease nausea and vomiting. So I did not know pyridoxine is something that we can use to lessen the nausea and vomiting. However, more than 100 mg can cause defects in the fetus. So blank is something. Okay. When there is no vomiting, SFF. Wala ko balang sana. I&O monitoring. Presence of bile. Poses a risk of electrolyte imbalance. So, ito na pag mag-high electrolyte imbalance. 100 mg. Initial vomitus and digestive food. Tachycardia ang compensatory. When there is no vomiting. SFF. Ito muna. Pyridoxine. Toxemia. What is toxemia? So I'm just going to browse. What is this? Pregnancy-induced hypertension. It's also known as toxemia? Really? I did not know that. I did not know that it's also known as toxemia, ang pregnancy-induced hypertension. Okay, but anyways, before we go over that, placenta previa and placenta, I think we will be just quick at this.